Hi everyone, I'm Dr. Sherry, Chief Medical Officer of Women's Health at QuickMD. Today we're talking about something that comes up a lot, especially during perimenopause and menopause, and that's hair loss. If you've noticed thinning at the part, more hair in the shower drain, less volume in your ponytail, or you're avoiding mirrors under bright lighting, you are not imagining it, and you're certainly not alone. Hormonal changes during perimenopause and menopause can absolutely affect hair growth, density, and shedding. And one medication that more women are asking about is oral minoxidil. In this video, we're going to talk about what oral minoxidil is, how it works, what results to expect, how to use it safely, and who it's good for. We'll also clear up some internet myths that tend to pop up when this medication is mentioned. So let's start with the basics and why the oral form is getting so much attention. Minoxidil has been around for a very long time. Most people recognize it as a topical foam or a liquid solution applied to the scalp. But minoxidil also exists in tablet form at a very low dose, and it's increasingly used for hair loss for women. An interesting fact is minoxidil was originally developed as a blood pressure medication. One of the side effects researchers noticed early on was increased hair growth. And that side effect turned out to be very useful. At low doses, minoxidil helps hair grow by increasing blood flow to the hair follicle, prolonging the growth phase of the hair cycle, and helping follicles produce thicker, stronger hairs, and this is why it's so effective. So why oral minoxidil instead of topical? Many women prefer oral minoxidil because it's easier to take than daily scalp application. It provides consistent dosing and it doesn't leave hair looking greasy. Oral minoxidil is often prescribed off-label, which is very common for some medication. There is, however, a new medication in clinical trials that could be FDA approved for hair growth. Some women ask if oral minoxidil is more effective than topical, and for some the answer is yes. Especially if topical treatments weren't working, were irritating, or were hard to stay on track with. How does minoxidil actually make hair grow? It doesn't create new hair follicles, but it helps existing hair follicles perform better. Now let's talk about some myths. One of the myths is you have to take it forever or all your hair falls out overnight. Hair changes happen gradually, both starting and stopping medication. No instant disasters will happen here, I promise. Another myth, oral minoxidil causes major heart problems. Now, at low doses used for hair loss, serious heart issues are very uncommon in healthy individuals. Let's talk about what women actually want to know. Does it work? For many women, the answer is yes, especially for scattered hair thinning, pattern hair loss, and chronic shedding. Women often notice will be reduced daily shedding, improved hair density over time, thickened hair strands, and much better regrowth and more consistency. And that is not an instant transformation. It's about slow, steady improvement, but it will happen. So when will you see results? Here's what's typical. For the first 1 to 3 months, possibly you'll see increased shedding, which is normal, but the 3 to 6 month, the shedding stabilizes, early regrowth will start, and 6 to 12 months, you're gonna notice improvement in density, volume. Now remember, hair growth happens slowly, so please be patient. Any treatment promising overnight results is just not true. A common question I hear is, will it help my hairline? Now, it can help, especially with hair thinning, but genetic hairline recession may respond less dramatically. It can help with stress-related shedding by shortening the shedding phase and supporting regrowth once the stressor has passed. Now let's talk about how this is actually taken. Oral minoxidil for hair loss is prescribed at very low doses, much lower than what's used to treat high blood pressure. For women, typical doses are often 0.25 milligrams, 0.5 milligrams, or 1 milligram daily. If that sounds very low dose, that's because it is. Let's address the part that tends to make people nervous. Now, at a very low dose, side effects are extremely rare, but can include mild ankle swelling, lightheadedness, increased body hair or facial hair, and temporary increase in hair shedding. Most side effects are dose-related and very manageable. Oral minoxidil may not be appropriate if you have a significant heart disease risk, blood pressure conditions, or a history of fluid retention. This is why medical supervision matters. Oral minoxidil works well for women experiencing thinning, shedding, or pattern hair loss. It's an effective and convenient option. You deserve real information to help you make informed decisions about your common and disruptive symptoms of perimenopause and menopause, especially hair changes. I hope this video cleared up any misconceptions about oral minoxidil that you may have heard or you learned something from this video to help you feel more comfortable using it. Thank you so much for being with me here today.